Hello everyone, welcome to Mean Business with Vestitude. In today's topic, we're going to be discussing something very eye-catching, innovating and insightful, and that is how to break into investing in healthcare. Right beside me, I have the delectable, and I'll let her introduce herself.
Hello everyone, my name is Rejoice Azodo. I'm the lead consultant healthcare business for Vestitude Limited.
And I am Anne ACB, General Manager, Vestitude Limited. So, before we get into this video, I'd like you to understand that by the end of this video, you're going to be picking up insights and gems and all you need to break into investing in healthcare. So, without wasting much time, let's dive right into the video. So, Miss Rejoice, I was reading your article some time ago, and one of the articles I read, one of the statements you made there that struck me was medicine is a profession, but healthcare is a business. Like, that was really deep. Like, it hit me, and I was like, wow, what's that? I would like you to shed more light on why you said that.
Okay, thank you very much, Anne. So, I feel like people, even healthcare business owners, are yet to make the distinction between medicine and healthcare.
Okay.
So medicine is a profession. You go to school, you study, you become a doctor or a medical professional, so to say, right?
Alright.
But the practice of medicine is entirely different from running or owning a healthcare business. Healthcare, just like every other business, is a business. And must be treated strictly like a business.
Like a business?
Yes, of course, you are in the business of saving lives.
Yes.
But you are not running a charity organization. So the same way you invest in any other type of business, it's just the same way you invest in healthcare.
Wow, it's profound what you said there. Healthcare is a business and it's not a charitable organization. So I do know that the medical profession has been associated around a lot of sentiments about doing good and meaning well.
Yes.
But I've come to understand, in fact, there's so much development around doing good properly, and that is making sure that the resources that are available are being maximized to make sure that you can bring the output you want. And so if someone is not properly taking the healthcare business, and treating it as a business, so to say, then the output, the effects, the profitability, the gain, the goals and objectives that the person intends to achieve by setting up that business will not be achieved.
Okay, so let me just add something right there that is probably going to make it more explanatory.
Okay.
So, healthcare is a business, a vehicle to save lives.
A vehicle.
Or to do good.
Wow. Okay.
So, but it is a business. It must be treated as a business. It is a business, of course. You now use it because a lot of people that get into healthcare businesses usually have good, great intention.
Yes.
As a matter of fact, healthcare is one of the major vehicles for impact investments. So you want to invest to touch communities, save lives, but you are still investing in a business.
Wow. Well, so that leads me to my next question, and I think that this is something that's going to be on the heart of a lot of people, and I hope that by the end of this video we can really answer those questions. What do you think are misconceptions that the average person has about healthcare itself? Okay,
so the misconceptions in quotes that an average person may have about healthcare business is, first of all, if you are not a healthcare professional, you cannot invest in a healthcare business.
Okay, that's wrong. That's incorrect.
Yes, that's totally wrong. And that has not just been a misconception, it has been a major barrier to driving private sector investment in healthcare.
Wow.
Because think about it, there are a lot of high net worth individuals, there are a lot of organizations or people or syndicates, right, who pull funds together and invest in different businesses like fintechs.
Yeah.
And you don't even think about it or think about investing in
healthcare. Wow.
And meanwhile, it's also noteworthy that healthcare business is a viable business. It is an awesome investment ground because unlike a lot of industries, everybody is your customer. Everybody working on the street is your customer.
That's so true.
I can't really think about an industry where everybody could potentially be your customer. I could be wrong. Yes, there are of course food and all that. But the thing about healthcare, that is why healthcare is an essential service. And that tells you that there will always be markets for your products, for your services. There would always be influx of patients if you do your maths well and if you run your business well. So the major misconception that has been, not just a misconception, been a major barrier is towards driving private sector investment, is the misconception that if you are not a healthcare professional, you can't start or own a healthcare business like a hospital or a healthcare facility.
Wow, that was amazing. If I could put an applause right now, I will. That's like, so just take it in. I know she said a lot at that point, but take it in. You can watch this video again and again so you really understand. So you said something that really struck me. You said that healthcare is one of the impact-driven businesses that exist.
Yes.
And when you said that, I just realized as you continue to speak that one of the industries you cited, like fintech, it usually is put forward as something that's coming to bring solutions, bring change. It's usually applauded. So now I really want you to help the listeners or people who might be interested in finding how to bring or drive impact and still make profitable businesses. I want you to show them how they can drive impact through creating viable business environments or viable businesses through healthcare. So how can someone who's interested, who has said, oh, okay, now I know that this is a playing ground, I can bring in money here, I can put resources here, how can this person come into healthcare? Especially if the person is a first timer or even a medical professional but knows nothing about business, how can they come into healthcare investment?
Okay, so a couple of channels come to mind, but
Okay.
I think I'll just basically speak about three. And the reason why I want to stick to this is, of course, because of our time.
Okay.
So one of the major ways, and I would say the most popular way to invest in healthcare or to get involved in healthcare businesses is usually to own or set up healthcare facilities.
Okay.
Right? So you could set up your own hospital, you can set up your own diagnostic center, dialysis center. I mean, the demand for these services are always there, especially for a country like Nigeria, where we have not even hit the global targets or the global standard for healthcare delivery, and still need a lot of a lot of private sector involvement. Because think about it, we can't just leave it all for the government.
True.
Or the few doctors around.
True that.
We have to get involved. Imagine high net worth individuals putting funds together, more like a syndicate, right, of investors, and building a well-equipped, ultra-modern hospital or healthcare center that renders different services. Take, for example, like to set up an oncology center.
Wow.
Because it's pretty expensive. That's another thing, right?
It is.
That's probably one of the major barriers towards entry. But there are people that have these funds. I mean, people build hotels every day.
Yeah.
And that is not to say that that is not a good business, but we are talking about impact investment.
Yeah.
Investing in an industry that enables you to augment wealth while saving lives. Now, imagine the demand for oncology services, but how many cancer clinics do we really have around?
Sure.
Because I understand is a heavy capex. The initial capital investment involved is quite heavy, so it's not a shop you see around every day. But when individuals can single-handedly or pull funds together to set up these centers, I mean, you're making your profit.
Sure.
But more importantly, you are saving lives. I mean, people build 5-star hotels. Why can't we also channel these funds towards building cancer centers? And the thing about this kind of investment is that it outlives you.
Sure.
Hospitals will
It's a legacy.
outlive you, yes. So you leave something for your children. Your name will always be remembered. and be written in the sand of history.
And the lives you've changed, the lives you've saved,
You
will
can imagine.
always attribute.
Because you don't want
Yes.
to know the number of people that die every day.
I do have an
For
idea.
something as simple as a lack of accessibility to
Sure.
required healthcare services.
Sure.
So that is a very important investment channel.
Okay.
But that is not the only one. Now,
Okay.
this is what people usually would think
Okay.
about when you talk about investing in healthcare. There are a couple of other ways. Another way you can invest in healthcare is that you can fund a healthcare project.
Wow.
Now we have, yes, I like that. Now there are a lot of hospitals around that are under-equipped.
True.
Now these hospitals have capacity, they have potential,
And professionals.
they are great investment prospects, right? But the thing is, they go through the challenge of funds, and medical equipment don't come cheap, especially with this exchange rate, this issue of FX. They are not cheap. How many hospitals, how many doctors around really has 100 million to pump into their hospital projects or their hospital business, so to say, to scale it up to the point where they are able to provide the required services? So you as an impact investor, you as a high net worth individual, or you as an investor that is really looking to augment wealth, instead of always thinking about, buying stocks, building hotels, or doing, what I'm talking about, one of those
I know
things.
them. We're not going to call names.
Yes, so you can just, of course, it's good, you can diversify your investments.
Yes, of course.
But imagine the impact you would be making if you channel something as little as maybe $100,000 in a hospital project. Now, hospitals can use these funds to scale up. They can purchase medical equipment. They can expand the scope of their service. They can improve their service delivery. They can even enable them pivot from the traditional paper-based record management system to more electronic and sophisticated hospital management systems to improve service delivery. Now, you can do this for either a share of the profit over a tenure, or you can do it for a certain returns, a certain monthly or quarterly or annually returns based on your agreements with the hospital. And that's an excellent investment channel. And this, I also want to say that this is a really great way for someone who is a first timer to break into healthcare.
Okay.
Because you get to leverage on what is existing already.
Okay.
You are involved in a healthcare business, you are part of it, you get to see the nitty-gritties, how it works, the challenges you're likely going to encounter. So maybe at the end of 5 years, 10, whenever when your investment is due, you can now decide to set up your own facility. So this will be a much more low-risk way
for someone who is testing the waters.
Yes, of breaking into health investment compared to outrightly owning your own facility. And that does not mean owning your facility is a huge risk. You cannot succeed at that, no. Because of course you would partner with medical professionals who are skilled in the business of healthcare already, and your investment is still safe. Then another way you can also invest in healthcare is to expand the scope of the services of an existing facility.
Wow.
Take for example a hospital that has a gynecology clinic, has maybe a pediatric clinic, but doesn't have a dialysis center. So you could set up a dialysis center in that hospital. So it's more like a partnership. Now you could decide to it could be named after the hospital. It could have a different name. Take for example, this hospital is Charity Mother and Child Healthcare Center, and inside this place you have a God is Good dialysis clinic, anything you want to call it. So that is another way. Now the beautiful part about this investment channel or vehicle is that you get to leverage on existing resources in this hospital compared to starting up a standalone dialysis center. Take for example, they already have a patient influx, or they already have
they have a market already. Yes.
There's an existing market. Thank you so much, Anne, for that. You get to share resources. So you don't have to hire staff from beginning. You can redistribute staff, right?
Yeah.
You get to share
the regulatory permits.
Yes.
You don't have to get licenses as well.
Even if you is, I mean, the process is easier because this is an existing facility.
Okay.
Then you get to share the OPEX,
oh, wow.
the operating costs like electricity, because you are not coming fresh. So it saves you. This particular type of investment saves you like a lot of initial investment costs required to break into healthcare. If you're also thinking of, okay, probably you take for example, you want to start a diagnostic center. Of course, you could do a standalone, or you could just leverage on what's available. So the thing is that people really don't know that these investment vehicles exist.
I haven't heard it anywhere.
So
I haven't heard it anywhere really. And even if it exists out there, I like what Vestitude is doing, bringing it out to the average person to have that information. I mean, there are certain things that are doing well. There's certain oil mines, if I'll use that word, that exist, but those informations have been protected and hoarded. So I really love this opportunity that we have on Main Business to actually share this thing with the average person, or people who have been wondering about where to, start up with, how to start up with something that's going to be profitable, that would last long, and I'll leave them. So you've listened to this, and I think from this response you've given, we can see different investor profiles.
Yes.
The low risk investor, the person who wants to go all in.
Yes, who has maybe a bit more appetite.
Yeah, a
risk
bigger appetite. And the, oh my God, I don't want dirty work. Just show me somewhere I can expand. I love that. Okay, thank you so much for all the clarification you've given us in this video, and our viewers out there, I'm sure they are saying thanks already. So I think a very prominent question on the heart of anyone who is watching this video right now, or someone who might be interested in breaking into healthcare investment, would be, where do I start? Where do I go from here? Now I've understood the different ways I can invest, or I can grow my money and still drive impact. What do I do? Should I walk up to a hospital? What should I do? What would you ask them to do? What are the first steps they should take?
Okay, very simple. The first step would be to reach out. I mean, our emails would be on the, is it called the chat box?
Yes.
Right? You can send a mail, you can reach out to us on WhatsApp or whatever means. It is very simple. What we can do to get started is we have to book some form of section with you where we would have very rich conversation around what you really have in mind. It would be a good place to also understand your risk appetite, and how much all out you're willing to go, what you want to achieve, what are your goals, what are the key drivers, because something must have inspired you to get involved in or with healthcare investment. So all that are the things we are going to be talking about. Then we need to understand what your expectations are. So we are here for you basically, right? We're going to hold your hands, we're going to walk you through the process from start to finish. Whether you are looking to building a hospital, we are here for you at Vestitude. I mean, we have some ongoing projects right now where we are setting up an ultra-modern hospital with different services like oncology, nephrology, gynecology. I mean, and it would interest you to know that the owner is not a medical professional. As a matter of fact, he's coming from fintech, right? And that underscores the fact that you don't need to have a medical background to get involved in healthcare investment. And that's on one front. On the other front, we also have, we actually have a lot of clients from diaspora who let me put it this way, most of our clients from diaspora are usually more interested in funding healthcare projects.
Yeah.
So a lot of the ongoing projects we have or we advise on are around funding ongoing healthcare projects. So just reach out, whether you want to site dialysis center, diagnostic center, or any form of service with an existing hospital. You want to invest in a healthcare project, you want to own your own facility. I mean, Vestitude is here for you. And I feel like this would be a very good point for me to just give a brief description of what Vestitude does.
Thank you, please do.
Okay, perfect. So Vestitude, we do three major things, right? We manage healthcare projects. So that means if you want to set up a hospital from start to finish, we are there. It's called turnkey healthcare project management. Now, if you have you could probably have a land and you want to build on it.
Okay.
That's fine. You have partnership with developers, and you get to develop and plan the facility, because this is what people don't understand. Facility plan,
Getting it right from the beginning.
is very important.
Right.
I mean, there's a flow.
Mm-hmm.
As someone who is into health facility planning and design, I understand that. Okay, take for example the same way you design a product, UI UX.
Yes.
Right. You consider how the customers feel when they interact with your product. That is also happens when you are talking about planning your facility. There has to be an interaction, a flow. How close should the consulting room be from the laboratory? How do you assess the dialysis clinic? I mean, all these things are all considered, and that is why you need our expertise from day one. I mean, I see a lot of investors or medical professionals who hire the services of their friend's brother that is a doctor. I mean, it's usually really funny, and you start. That brings me back to what we said initially. Healthcare is a business.
Yes.
That's your brother's friend that is a doctor, is probably a medical practitioner. He is in the profession of medicine. It doesn't mean he has what it takes to advise you on how to start and build a successful healthcare business. Now, when you are talking healthcare investment, then you must talk to experts like us, because you have to get it right from day one.
Yes.
I mean, it's an expensive venture sometimes.
You have to do it the right way.
You can't afford to learn on the job.
Yeah, we're talking.
Of course, there are so many
about
things you are going to learn in the process, but you have to get it right from day one. That is really, and it's really important you talk to professionals. I also, we also, of course, drive the whole investment that involves funding projects and all that. We facilitate. And then another thing we also do is that we manage hospital projects, right? So to avoid the pitfall of I live abroad, my brother's younger sister's cousin is the one managing the hospital, and there are always issues on returns. And so when you're talking healthcare business, you have to talk to Vestitude first.
You have to talk to healthcare business experts.
Exactly. So I feel like that's just the summary.
That's the summary.
If you want to build a successful healthcare business or invest in one, you definitely have to talk to Vestitude.
Okay, people, you've heard it all. So our number, our email is right there on the chat. Reach out to us today and let's start talking about driving impact, making long-lasting legacies, and of course, turning over that huge ROI. Once more, my name is Anne Ezibe, and I'm grateful to have shared this time with you. Stay tuned. We have so much more coming for you in our next video. Cheers. Bye.